I want to give an update on the BRIGHT 1003 study, and this study is a randomized phase 2 study in which we compared Glasdegib plus low-dose Cytarabine with Cytarabine alone in AML patients and MDS patients. The majority of patients were AML patients, 116 patients, and an additional 16 patients had an MDS. The original study showed a survival benefit for Glasdegib plus low-dose Cytarabine, and after an additional 2 years follow-up, this survival benefit was confirmed with a hazard ratio of 0.5. What is interesting and novel in this this update, in this poster, is that we separated the disease by diagnosis. So de novo AML patients were looked at, and secondary AML patients were looked at separately. And the survival benefit was especially strong in the secondary AML patients. So what is interesting here, beside this fact, is that the patients were very old. The median age was 77 years, and the patients had a high rate of cardiac complications and pre-existing diseases. So almost around 50% of the patients had a pre-existing cardiac condition. So if you look at the median overall survival in the group of patients with secondary AML, Glasdegib plus low-dose Cytarabine had a median survival of 9.3 months, while it was 4.3 months in the LDAC alone group. What about the safety? The safety was compared between the first within the first 90 days and in the 90 day after 90 days, and the safety overall was well. The combination was well tolerated. The on-target side effects of Glasdegib were found, of course, more frequently in the Glasdegib group, and this is especially dysgeusia in 25% of patients and muscle spasms, which usually occur after 3 months of treatment. They were found in 22% of the patients, and alopecia is also an on-target effect of Glasdegib that was found in 10% of the patients. So, yeah, in conclusion, the combination treatment has an acceptable safety profile. It is effective, more effective than LDAC alone, and the results of the primary cutoff and primary presentation were confirmed.